Hey, it's me. This is a really good question. You know, when you donate blood, you're donating about 500 mils, right? Half a litre of blood. And half of that's plasma, the other half are cells. And they take the cells out of that blood and they separate the red blood cells, the white blood cells, and the platelets. They put the platelets in their own little separate bag. They put the red blood cells into their own bag. They're called packed red blood cells, or PRBCs. And the white blood cells, well, they just throw those in the bin. Nobody gets them. They're just like waste. The white blood cells are no good. If I gave you my white blood cells would attack your body. That's kind of like a host versus graft disease, right? But what happens to the plasma, and what's in the plasma? Well, the plasma is full of things like albumin and coagulation proteins and electrolytes, right? So they're going to freeze that plasma, that liquid component of my blood donation. They're going to freeze that and set it aside. And then they're going to do exactly the same with the next person who comes along with the same blood type that I've got, and take off their plasma and freeze it. And the next person and the next person and the next person. There's multiple people who have donated plasma that contains all of those coagulation factors, and they set those aside. Frozen, they set those aside. Now what they're going to do is they're either going to use that fresh frozen plasma, that's called FFP, and they can donate that back to a patient, say in trauma or surgery, or somebody who needs fresh frozen plasma, who needs plasma. And what plasma brings is coagulation factors, and it brings albumin, and it brings other globulins and immunoglobulins and antibodies, all of that sort of stuff, right? Everything that was in the plasma is still there when you freeze it. And they thaw it out and they give it to people. But what if you didn't want all the plasma that I've got to give you? You know, you needed a transfusion, but not of plasma. You don't need a transfusion of red blood cells, but you've got a problem with your bleeding. You've got a clotting problem. And I just need to give you really concentrated coagulation factors. You know, things like factor VIII and fibrinogen and prothrombin and von Willebrand factor and factor XIII, all these different coagulation factors that are in your blood. If I needed to give you concentrated coagulation factors, what I'm going to do is I'm going to take that fresh frozen plasma and I'm going to slowly start thawing it out. And as I slowly thaw out that fresh frozen plasma, what precipitates out, that first part of the thaw, they are your concentrated coagulation factors, and I can collect those without all the water and put them into what is called a cryo-frozen precipitate, a cryoprecipitate. That's what cryoprecipitate is. It's concentrated clotting factors, coagulation factors, for people who are bleeding or have the tendency to bleed. Hope that helped.